Next up, we have James Trice. James is doing his topic is important cannabis terminology. Um, his bio is, for about 20 years, Mr. Trice has been an active advocate in the medical cannabis community. Whether it's researching or its medical benefits of cannabis or hemp, performing patient assessments and documenting vitals, helping patients register for the state 329 program, and volunteering with local VSOs to bolster their sustainable gardening programs. Mr. Trice is prominently known for his patient advocacy through events such as the 329 Veteran Stand Down, his past work with dispensaries such as patient education, smoking, and vape safety. Um, Thank you, James.
Thanks for having me. Good morning, everybody. For a couple other faces, they didn't make it in, it's okay. I actually had a slideshow for you guys, but I'm not sure if you guys are familiar with Doodly. It's kind of an animated, like slide thing. Either way, it wasn't pulling up, so I'm just gonna have to try to get this going like this. But good morning, and especially to the new patients and caregivers. As we all know, well, I only have a little under 10 minutes to relay the message, so I'm going to try to speed through this because it was long. But if you miss anything, let me know, and I can try to get you the slides. I'm sorry, out of frame. So, a lot of times with new medications, we can get overwhelmed or confused with the names, like the over-the-counter name versus the generic name and things like that. For example, Tylenol typically equates to acetaminophen. And then you have things like how Motrin typically equates to ibuprofen. What about dronabinol? Is anybody familiar with dronabinol? Only a few people? Okay. Short history on dronabinol. Dronabinol is a synthetic THC, a form of synthetic THC, sorry. In 1985, dronabinol gained federal approval for treatment of HIV/AIDS, induced anorexia, as well as nausea and vomiting related to chemotherapy, things like that. This is where things kind of get a little tricky. What about other common terms that aren't interchangeable, things but still often get misused? Oftentimes, a lot of times, you hear words like marijuana being used in place for medical cannabis or sometimes even hemp. Marijuana is illegal, obviously, and is typically imported from Mexico and is of poor quality, while medical grade cannabis is typically grown in a well-controlled indoor atmosphere and must go through a number of rounds of testing prior to its consumption by our DOH patients here in Hawaii. Sorry. As you can see, I enjoy using my voice to advocate on behalf of patients, and I like to talk. And I place a strong emphasis on grammar. Grammar and clarity are keystones of communication, especially, sorry, Kai, especially when communicating multiculturally. Proper grammar and enunciation shows your respect to your audience, reassuring them of your knowledge and understanding of the subject, and maintaining their trust with your wisdom. Speaking of which, here are some terms that may be new to you, or words that you may hear often in regards to medical cannabis or hemp medicine, but aren't completely sure what they mean or why. So I've compiled a short list of roughly 12. I have some more again. If you'd like the complete list, I'll send you out the email or email us at 808camo.org. The first one is 329. Hawaii, the term 329 is unique to Hawaii as, maybe I should stand closer to the speaker, it keeps going in and out. But the term 329 is unique to Hawaii as it relates to state statutes. Hawaii Revised Statutes, Title 19 of Health, 329 Uniform Controlled Substances Act, 329-121. Another term you may hear often now is medical, which is of or relating to or concerned with physicians or the practice of medicine, obviously. What about things like, I think Brent touched on, recreational use. A recreational drug is a drug typically such as cocaine, or like we said earlier, the marijuana, or most recently, methamphetamines, that are used without medical justification for its psychoactive effects, or on the belief that occasional use is, it's just okay, use it in moderation. There's adult use, and adult use is what most of us typically know for obviously being of age, legal age of consent to utilize alcohol. In Hawaii, I think it recently is up to, do we pass it at 21? Is it 21 now? Before it was a lot lower. It was actually 17. I think it was 16 in 2004. I have to check, but it was a very low age. So you can understand why some parents and elders would have concern with their young age, mid-teens, possibly consuming this medication. Something that we get a lot of confusion about a term is terms like sativa. Most commonly, we hear sativa used as the most common form of cannabis. It has very long, slim leaves, and the phrase itself typically means cultivated. Whereas one that we get related to hybrids called ruderalis. The root word of ruderalis is ruderol, meaning a plant that grows in spite of its environment or natural climate. It's often used to label wild strains or strains of hemp plants that have low THC content in them, typically. Specifically, ruderalis is a shorter version of the cannabis plant, hemp plant, and grows about 1 to 3 feet tall, typically, usually no more than 4 feet tall. And it has a very fast grow rate, typically harvests within it's like 7 to 8 weeks. It's a fast plant. Indica, typically considered, or what you hear as like the downer or indica-couch kind cannabis, has the wider leaves. And though many cannabis clubs and dispensaries typically label most of their plant material sativa and indica based on their effects, the what we call up or down effects. But really, because it's such a broad spectrum of how each different land races and different strains of cannabis interact with each other, it's actually not too practical to use that as their way of classifying plants, as it's actually very inaccurate and typically more tests need to be conducted. Which brings me to terpenes. How many of you are familiar with the term terpenes? I know not everyone. Nice, at least half of you. A short definition of terpenes, a short understanding of terpenes rather, is where that cannabis itself has a high concentration of terpenes, which is why the plant is typically so pungent and odoriferous, yes? Some people obnoxious and it's very strong. There are 5 typical main terpenes found in the plant, such as pinene, that we typically find in things like rosemary, and what the other was. Linalool, which smells more floral or kind of has a sweet flavor, sweet scent, to it, that you typically find in things like lavender. Limonene, which is things you find in citrus or like a orange or grapefruit scent. Whereas one many people are more familiar with, which is myrcene, that you find in things such as thyme and lemongrass, and carafeline, which has a more spicy or more woody, or possibly nutty, like peppercorns or cloves. The reason why I bring those together in that manner is because a lot of people are familiar with these via their grandparents. I know I grew up My grandmother stayed with a satchel or even I think a bowl of potpourri. Potpourri dish everywhere. We have one in Mama's room. We get one in the pretty room at the den. Ours was a very pretty room, so we call it the pretty room. But the even coming in from football practice, and you walk in, you're tired, but something about the smell of that scent, awakening, kind of it reminds you of home. It's very familiar and very a comforting scent. So it's very interesting that you find many of these scents based in most, if not all, land races of hemp cannabis. So the potpourri. There is plenty of clinical trial data that supports the herbal synergy of cannabis and reaches far beyond those effects of the single components such as just the CBD or THC that we typically are usually mentioning. The way that cannabis can provide therapeutic relief through our sense of smell is phenomenal. Like we were just mentioning how the scent of the potpourri draws back to memories of home. Also, rather than smoking, excuse me, rather than smoking and risking inhalation burns from cannabis and cigars and inflammation of the lungs, maybe you prefer a potpourri array rather than, or someone who cannot utilize the edibles because of the different forms of nausea. Some people have stomach ulcers, whereas the syrups or the sugars that people use when they make their edibles, it acts in a way that is contrary, to, their ailment. So it kind of irritates them. Another word that we hear often related to medical cannabis that it's more of a sour word, and I think it needs more clarification, and it's addiction. Words like addiction typically means it's a compulsive disorder, that's something that you are drawn to using or utilizing the substances, habit forming. Typically it's deeply psychological, but often muscle memory and physiological effects of things such as happiness or the lightness, the tingle you get, and things like that, typically drive most people's addictions. And it's very difficult to reach someone who is enjoying something, rather a patient who is not too geared towards medication, yes. Oftentimes with addiction as well, you see irritability, anxiety, and difficulty to communicate some of their emotions a lot of times. And for a caregiver or for a family member, that can be very heavy on your emotions. Some people who have elders who suffer from Alzheimer's or who suffer from dementia, and you definitely know you're trying to communicate with someone and you're trying to, emotional, but you're trying to help them and communicate something to them, and you just don't have the right words. But I say all that to say that even legally it matters. Something I've always been told from my elders was, you ask the right question, get the right answer. And more specifically for my local community, my Hawaiians, my Filipinos, who English is not their first language. So unfortunately, it's that much more important for them to have a strong understanding of the words, how to say what to say, because not everything translates, as well. And sometimes what you hope to, the message you hope to get across doesn't always get relayed. So again, proper grammar, proper understanding that words have definitions and meanings, and knowing when to use them, and not to be more responsible even on social media when we're speaking on things. We're not labeling people or patients. We're not criminalizing patients. You see it? Though the words may be cumbersome at times, it is highly imperative that we say what we mean and mean what we say, especially regarding regarding and speaking in health terms and when dealing with patients. If you would like this list, as well as, I'm sure I have a longer list of terms and any more information, especially for beginners, introductory caregivers who aren't really in the know, please feel free to reach out to me at 808camo.org. My name is James Trice. If you see me on Instagram, reach out to 808camo, at 808camo, sorry. And even on Twitter, although I'm not always on there, but I will respond at the same handle. Yes, at 808camo. So thank you for your time, and Allah.